Hi everyone, hope you're well. I'm just going to share in this video blog my experience with examining ITU patients with COVID. I was asked this morning to examine 2 COVID positive patients in our ITU, and both of them had grown candida in their lines, and they wanted us to rule out any intraocular involvement. I discussed both cases, with our uveitis team, which agreed that because of the patients being unconscious, that it would be best in this type of scenario to examine them. The first thing I did was to phone our emergency eye department at Manchester Royal Eye Hospital to make sure that we had the equipment ready. I requested 2 sets of each drop that I needed, which included fluorescein, proximethicane, tropicamide 1%, and phenylephrine 2.5%. I also asked them to have our COVID dedicated indirect ophthalmoscope ready and cleaned, and have a set of 28 diopter and 20 diopter disposable lenses, 2 sets of each, in case one got damaged or contaminated and we needed a substitute. I also changed into theatre clothes, so I could go in, examine, obviously putting all the PPE, examining the patient with these clothes, and then I will try and get changed at the ITU changing rooms, and if possible have a shower, and then I've got another set of new clothes to put on. I will put these in a plastic bag and bring them back to the eye hospital for cleaning. I then phoned the ITU department and asked them if they could put some dilating drops in each patient in both eyes for them to be ready when I arrived and minimize the amount of time and contact that I was in the unit. I also asked them to have vials of voriconazole, 200 milligrams of the powder solution, ready in case we needed to give any intraocular treatment. Remember that voriconazole is unlicensed for intraocular use, but I believe that this is the accepted treatment for intraocular use in this type of cases. I will be posting here in our ED group the guidelines on how to reconstitute the drug. I arrived at the IT department and I found all staff to be really helpful, and they were very keen to show me how everything worked and the way, or the proper way, to wear the PPE. I was asked by the ITU department to bring with me my fitted mask, but they were happy to provide me with one if I needed it.
Thank you. So I'm in the intensive care unit at the moment, and I've had very helpful colleagues showing me how to get geared up for the examination. So as you can see, fully gloved gown, double hats, and we've covered the indirect ophthalmoscope with a hat, so that gets as protected as possible. So we will need to just sterilize all the hat, but mainly the front bit that's exposed. This is the clean area. Just make sure that you have all the things that you need taking with you when you're going to examine the patient with you now, because you can't come back into this area to take anything. I'll see you in a bit.
I've finished examining the patients. Again, the nursing staff has been absolutely marvelous, showing me how to make sure that I did the doffing correctly. And fortunately, both patients did not have any retinal involvement or ocular involvement with the candidemia. I'm now in the male changing area, again, or female, if you're a female, and I've been given a towel, and I'm going to have a shower and change into totally clean clothes and take these scrubs back to the hospital and put them in the cleaning. See you in a bit. So,
that was my experience this morning. I felt quite safe. I think the guys in ITU have been just absolutely amazing. So I really need to thank them. And I'm very, very happy here to help you all, as you know, if you need any points clarifying. Take care and stay safe.